I would like to take a few moments to discuss the broader issue of health care reform. To be honest, we've never seen anything like the issues facing our country right now. We're at a pivotal point as a nation. The line between private businesses and public government has never been so blurred. Government effectively owns several of our nation's financial institutions, insurance companies, and auto manufacturers. CEOs have been fired by government bureaucrats, and Washington is now in the business of running our health care system more than ever before. Our fiscal outlook is bleaker than ever. According to the recent 10-year outlook by the Congressional Budget Office, the CBO, the current administration's policies would add $8.5 trillion to our already record national debt. The report also confirmed that we would be facing a record deficit of $1.5 trillion this year, along with a dire prediction of our deficits only getting worse after 2015 and beyond. Now, let me put this in perspective. Our deficit this year is the largest yearly deficit since 1945. It is 10% of our entire economy. Our national debt is on a path to double in the next 5 years and triple in the next 10 years. According to CBO, our national debt will explode to $20.3 trillion by 2020, or 90% of our GDP. We are literally drowning the future of this nation and the future of our kids and grandkids in a sea of red ink. I deliver these remarks with a heavy heart because what could have been a strong bipartisan bill reflecting our collective and genuine desire for responsible health care reform turned out to be an extremely partisan exercise, resulting in one of the largest big government spending bills being signed into law yesterday. Now, we are jamming through another 153-page edition of new taxes and spending. Recent polls show that a majority of Americans remain concerned and skeptical about all the promises of reduced deficits and lower costs under this legislation. Why? Because they know there is no such thing as a free lunch, especially when Washington is the one inviting you over. According to the administration's own actuary at the Centers for Medicare and Medicaid Services, CMS, the health care bill signed by President Obama yesterday will actually raise our total health care spending by $222 billion over the next 10 years. And that doesn't even include the doc fix that the distinguished senator from Arizona was talking about, which is as much as $371 billion more. But the most cynical joke played by Washington on the American people in this entire exercise has been the promise of this $2.5 trillion tax and spend bill actually reducing our deficit. Nobody believes that. The biggest bait and switch on the American people about the bill's impact on the deficit is a simple math trick. If something is too expensive to do for a full 10-year period, just do it for 5 or 6 years. Most of the major spending provisions of the bill do not go into effect until 2014 or later, coincidentally after the 2012 presidential elections. So what we are seeing is not a full 10-year score, but rather a 6-year score. According to the Senate Budget Committee, the full 10-year score of the Senate bill would approach $2.5 trillion. We're already spending $2.4 trillion. More importantly, let me also clarify what the Congressional Budget Office has said on the nearly $500 billion in Medicare cuts, which my friends on the other side argue will magically not only extend Medicare solvency, but also pay for the large part of this bill. This is like telling American families that they can spend the same magical dollar to not only pay their mortgage, but also their credit cards. It is nonsensical. Here's what the experts at CBO said. The key point is that the savings to Medicare Trust Fund will be received by government only once, so they cannot be set aside to pay for future Medicare spending, and at the same time pay for current spending on other parts of the legislation or on other programs. By the way, did I mention that at a time when major government programs like Medicare and Medicaid are already on a path to fiscal insolvency, it is interesting to note that more than half of the newly covered lives, 16 million out of the 32 million, are simply being pushed into the Medicaid program. And if anyone thinks that states who are facing more than $200 billion in deficits will not be left holding the bag in the future, then I have a bridge to sell you. I've said all along that this is not a fight between Republicans and Democrats, but a fight between Democrats and a majority of Americans who do not want this bill. In town hall after town hall and poll after poll and election after election, Americans begged Washington to listen to their voices. But Washington ignored them and used every means necessary, from backroom deals to procedural trickery, to get this bill passed. We need to remember the real implications of these policies, not simply in terms of political legacies and ideological holy grails, but in terms of its impact on the future of our children and grandchildren. We need to ensure that they have the same opportunities to prosper that we've all been blessed with. Let me just say a few minutes about a motion to commit that I will be offering. My motion to commit states that if the actuary of the Department of Health and Human Services certifies that 1 million Medicare Advantage beneficiaries lose their coverage or benefits, the cuts to the Medicare Advantage program will not go into effect. It is that simple. It is important to point out that the bill the President signed into law yesterday would slash $120 billion from the Medicare Advantage program. This reconciliation bill would cut the program by an additional $66 billion for a grand total of $202 billion. Before the health care reform bill was signed into law, CBO projected that Medicare Advantage enrollment would have increased from 10.9 million in 2010 to 13.9 million in 2019. Now, Medicare Advantage enrollment will be 4.8 million less numbers of people in 2019 due to the passage of the new health bill, or almost 2 million less than today. CBO also projected that rebates for additional benefits and reduced cost sharing offered through Medicare Advantage would be reduced by 50% from $135 per member per month to $67 per member per month in 2019. These lost benefits include lower premiums, lower co-payments, and lower deductibles. It will also impact everything from hearing aids to dental and vision benefits. Most importantly, it would violate President Obama's own pledge to, quote, "If you like what you have, you may keep it," unquote. Medicare Advantage works. Every Medicare beneficiary has access to a Medicare Advantage plan. Almost 90% of Medicare beneficiaries participating in the program are satisfied with their health coverage. It is time for us to stand up for more than 10 million seniors and ensure that this program is not used as a piggy bank to finance Washington's big government plans. I appreciate my colleagues allowing me to go maybe a minute longer than I should have, but I urge my colleagues to support my motion to commit this bill.